Welcome to Murx Product Demo. Murx is a next-generation software for practice management and BHR with compliance with Meaningful Use Stage 2. Here we have listed out for you the core objectives of Stage 2. First, let's focus on front desk workflow, the tasks done by the front desk. Schedule of appointments. Mark patient arrival. Registration of patient. Recording visit details for the patient. Now let's move on to the application. We log in with the front desk credentials for the facility. Dashboard displayed customized to the front desk. Select the schedule icon to schedule an appointment. On scheduler, select the provider for whom the appointment need to be scheduled. The screen displays the occupied and vacant time slots. A pop-up appears for recording appointment details on click of the vacant slot. After entry of the necessary field, appointment is scheduled on click of the button OK. Appointment can be scheduled for existing as well as for new patients. The appointments can be viewed in day, week or month format. Now let's move to the next task, marking arrival of the patient to the facility. On click of the icon Patient for Visit, the patient scheduled for the day are displayed. The records where patient ID are present are existing patients of the facility, and the records without the ID are new patients. Record is selected to mark arrival of the patient. Demographic screen displays all required details for the patient. Provision for edit is provided. First tab displays contact details. Next to kin details for contact during emergency. Employer details. Multiple insurance policy can be recorded for easy access during future visits. Other details captures the race and ethnicity of the patient. Patient's preference for communication and preference for sharing data with other agencies recorded over here. Last, HIPAA and fire acknowledgement are recorded and stored in the prescribed format. We now proceed with recording the visit details for the patient. The patient banner is displayed with the basic details as recorded during registration. We enter the visit location, the visit type and applicable payment category, and record the visit. On record, the encounter ID is created for the visit, which will be the reference number for the current visit. This brings us to the end of front desk workflow. Let us now look into the workflow of nurse. Record chief complaint. Record patient vitals. Record or review allergies. Review immunization chart. Record patient history. Login with the credentials of the nurse. Customized dashboard displayed for the nurse. Continue the workflow by clicking Patient for Visit. Select the patient with status has arrived. The entries made by the front desk is displayed. Provision for recording and review of patient history. In social history, we capture the smoking status, alcohol consumption and drug abuse, along with education and lifestyle. Family history, we capture the chronic disease history of the family members. Under Medical History tab, we capture the surgical and disease history of the patient. The nurse checks the immunization chart for vaccines which are due. She may administer the vaccines if required and record it here. Proceed by recording the vitals. Provision for view of vital history is available. Next, we'll be recording the chief complaints of the patient. Provision for capturing multiple complaints. With the last tag, we capture the allergy details. Provision for recording no known allergies if none exists for the patient. Record new button allows for capture of new allergies. Multiple type of allergies like drug, food, etc. can be recorded. Next, let's check how lab and radiology results are handled. The nurse checks for the orders placed by the doctor. Collects and sends the specimen to the lab. On receiving the reports, she marks the order as completed and uploads the lab report. The report can be viewed in a proper format. The same for radiology. Once the order is processed and result is available, it is stored in a DICOM format. The result can be viewed with an DICOM viewer. This brings us to the end of workflow for nurse. The Murx provider workflow. View patient details. Record or review allergies. Record or review diagnosis. Prescribe medication. Place lab and radiology orders. Review and enter clinical notes. Patient referral. Immunization. Review and record advance directives. Let's move on to the application and check the provider dashboard. Relevant icons for the provider are displayed. Let's select a patient waiting for consultation. The patient chart for the patient is displayed. Patient banner on top of the chart displays the required general information of the patient. Allergy status is displayed prominently. The checklist below shows the clinical activities performed for the patient. Vital signs recorded for the patient are displayed with options for changing it or recording the new set of vitals. Let's check the tags on chart one by one. The first tag, called the face sheet, displays the overall clinical status of the patient, the current diagnosis, medication and allergies. It also displays the encounter history of the patient. On click of a particular encounter, review of encounter summary is available. Next tag, allergies. You may either record the new allergy or review the existing recorded allergies. Disease management, clinical decision support alerts, if any, are displayed here. Diagnosis record or review diagnosis. Active diagnosis is displayed in the list. If required, an active diagnosis can be viewed by selecting the status on top. Let's record a new diagnosis. Medicine or ICD code set can be used for recording diagnosis. Let's use SNO medicine this time. The recorded diagnosis gets listed as active. Multiple diagnoses can be recorded for the encounter. Medication. The active medications are listed by default. Provision for viewing medication history. New prescription can be created from here. Drugs can be prescribed as required. Drug interaction alerts are populated in case of drug-to-drug or drug-to-allergy interactions, or in case of duplicate therapy. On record, the e-prescription gets enabled. It can be electronically transferred to pharmacy or printed, emailed or faxed. Orders. Lab, radiology and procedure orders can be placed. The screen allows selection of multiple lab orders at a time. The selected orders are placed mapping with the LOINC codes and are made accessible to nurse for processing. Notes. Clinical notes. A format of SOAP notes is displayed here. The notes is a customizable setup. Here the subjective, objective and assessment are pre-populated as recorded in the earlier sections. Plan can be described here. Refer. The consulting provider may refer the patient to appear within or outside the facility. When referred, a transfer of care summary get generated and may be sent by fax, email or electronically transmitted. Immunization recording. The provider records the immunization administered to the patient using this screen. The recorded immunization can be electronically transmitted to central registries. Provision for recording adverse reaction due to administration of vaccine is available. The chart also provides for quick view of patient demographic details and patient history. Close consultation link is utilized for ending the consultation. The preview of clinical summary is available in the page. Let's check other icons on the dashboard. Lab results displays the completed lab results. The provider can view the report. On check of mark as viewed, the record moves out of the list. Similarly for radiology reports, the provider may view the DICOM images and mark them as viewed. Patient portal. Patients can log in to the portal and view their respective details. This effectively brings us to the end of the presentation. Thank you.